Good morning to all my viewers. So today's YouTube video is based on how to be a good medical student, especially in a surgical posting. So usually nobody tells us this, like maybe your seniors might help you with this, but usually no professor or no book tells you how to be a good student in a way that you can make the most out of your resources and make the best and the efficiency of the time. Making the best out of the time in the ward is especially very important as a student. So to begin with, the first thing is enthusiasm. So as a medical student, if you have been someone who have been aspiring to become a doctor right from your childhood, and it's been your dream career, and then you got into a medical school, then it would be something that comes from within, like something natural. But then me personally, I've been like dreaming of becoming a doctor ever since my childhood. So for me, every single moment in the hospital is like a dream come true, like I'm living my dream. So that's something natural in me, but I wouldn't relate that to every single person out there, because I personally know friends who have been pushed into this career either by family or the pressures from the society, and they didn't really want to become a doctor. So I see people get into depression, and they don't really, it's like they just pull themselves to come to the work every day, and there's no, everything, only when you put heart into it, it like you can be successful in it. So that's the first step to success, that you really enjoy doing what you do. Becoming a doctor is a long-term thing, and doctor is like a very huge journey, and it has like a long way to go, but then enjoying the journey and cherishing every single moment of your medical school life is really important. Second thing is curiosity. So as a child, curiousness and inquisitiveness was imbibed in us, but as we grew up, we just like probably didn't wonder much about things as we used to do then. But as a medical student in the ward especially, being curious is the most important thing, because when you are left into the ward to be on yourself, you're given a certain specific time in the ward, and you need to practice your skills as well as learn from the staff, as well as observe the procedures and everything. So unless you're curious, you wouldn't really look into each and everything around you and try to learn from it. Consider every single moment as a learning opportunity. For example, like I would like to share one of the experiences I had personally in the ward. It was this malnourished patient who has been admitted in the ward for a very long time, and he has this total parental nutrition TPN bag, which is the nutrition bag, next to him, and it's being infused into him, and this bag had a blue colored cover. Okay, so I don't know why, like nobody ever like really looked into it or didn't really consider it to be something that you can learn from. But then the nurse asked me, do you know why the food bag is covered by a blue film? And then that's when, like, I didn't really know it was supposed to have a reason. I just thought it's like just the packaging is like that, but then no, it had a reason, because like the food had iron particles, and this iron and other substances which shouldn't be coming into contact with the sunlight. So when the ward receives sunlight from the windows, so to avoid the contact of the food with the sunlight, that was like a protective case to avoid like oxidation, and it will convert into some noxious substance for the patient if it came into contact with the sunlight. So things like this, when you look, you need to wonder as why, and then never feel shy to ask. Never fake yourself telling that you know this. When you question yourself, be honest, okay? Because being a medical student, it's not a sin to not know anything. It's like, okay, it's okay if you ask today, you will know, but if you don't ask, you will remain without that knowledge for a longer time, like eventually until the point you get scolded as a doctor or something. So never fake yourself telling that you know some particular thing. Always question yourself and ask whether you know this thing or no, like you're just telling yourself you know it. And then next thing I would say is being proactive. So this is especially something even my dad, as a doctor, he advised me that being proactive as a medical student is very important, because a medical student is just an extra responsibility to everyone else in the hospital. They're not really obliged to take part in educating you or teaching you skills, or even as a patient, they don't have the real obligation. Under certain hospitals, they do need to, like, they are forced to participate for student practice purposes. But other than that, if you're in a government hospital or anything, like, the patients don't really have to comply with you, unless you are being proactive and using the right skills, and all that comes only when you have the personal interest to learn. Nobody else can, like, it's not unlike the basic sciences year 1 and year 2, where like the teachers kept on like forcing you to read and study and all that. It's not that way in the clinical. You need to have the interest from within. So part of this even becomes becoming an early bird. In my particular hospital, our university has given us a privilege that we don't really have a specific like stipulated time, and not that we are not allowed to come apart from that time. We can go to the ward anytime and practice our skills, and whether it is working hours or anytime after that, we are allowed to go. But I do know medical schools in which, like, they have particular time within which the students are allowed to use the ward and use the patients for learning, etc. So even in such cases, make sure you are someone who is very early, reaching the earliest time possible, and try to observe things around you, try to follow the doctors, have very friendly relationship with your staff, especially the nurses, the interns, the houseman doctors, even the specialists, everyone, from the hierarchy, from the top to bottom. You really need to be friendly with them in order to learn from them. And once you're being friendly and respectful, they themselves want to teach you. I remember having really good relationships with some of the houseman doctors. They themselves used to like voluntarily call me when they're performing some specific procedure, and they really want me to observe and learn. And once you show interest, they also want you to learn, and they want to teach as well. So that is very important. Even learning from the nurses, especially things like just as small as IO charting, or even just as small as blood taking. All these skills are really important. Like, sometimes they are underrated, like we focus so much on diagnosing the disease and managing the patient, we forget that even all this comes under management, because like medicine is not a single-handed, no person can deal a patient single-handedly. It's like a multidisciplinary approach. So you can never be a good doctor unless you're able to really work with everybody, and it's like together being able to manage the patient. So all these skills right from the studenthood you need to inculcate in yourself in order to become a good doctor in the future, inshallah. So then apart from that, it is really important to be humble, okay? Because as a medical student, it is a high liability. You might get scolded, you might get scolded by the nurses. Even the patients might end up scolding you. Even sometimes, it is because it's like really stressful environment out there. Nobody is like, nobody is having fun time. It's like the patients are suffering, the doctors are really busy, like with their work schedules and everything. And on top of this, if they got to teach you, it's like really extra responsibility for them. So everyone is stressed out, and it is very, very, very likely that they're going to release their frustration on you. So in such situation, it is important, one thing, not to break down. As most of the girls, like once you get scolded, it doesn't take time for you to like shed tears. So don't be like that. You got to be stronger. Never break down, especially in front of the patients, especially. And then even if you're getting scolded, never have hard feelings towards them, okay? Because eventually only they are going to help you to learn. They're like, yeah, even the patients and everything, you got to be more understanding and more compassionate, and yeah, basically more humble. Because many times they will make you feel like you mean nothing, even less than a zero you would be made to feel. And at the same time, you got to maintain, you shouldn't break, and you should be strong. And so that comes along the way, but then when such a situation comes, when you're aware that this is going to happen, you'll be stronger. So that's why I want to share this thing with you all. Apart from that, it is very important to structure your learning, guys. So me particularly, Alhamdulillah, I had good friends. It's important to have good friends and good colleagues and classmates who can like, not just, friends are not just for fun. You even need to like be able to study together, relate together, work together. So when you have friends with make friends who have as much hunger for knowledge and learning and everything, who are willing to work hard. It's not necessary you got to make smart friends always, or be friends with toppers, or someone who is like always excelling in studies. Not like that. Someone who is really willing to learn. That's the motive. Especially always have friends with you who can accompany, and who can even be a chaperone for you when you're performing a physical examination. For example, it's always better for a female to have a male chaperone, because while examining a male patient, and vice versa as well. So always make sure you have friends like, and structure your learning, guys, because nobody teaches you as what to do in the ward. Like you're just left there, and you are given this time, and you need to make use of this time. So it's very important to plan this time, because in my particular batch, there are so many people who didn't even turn onto the wards, because there's nobody actually monitoring whether you're in the ward or not. So they just sign the attendance and they just leave and just have fun after that. But then no, you have to spend maximum time in the ward, guys, because more than books, the patients help you to learn. And not just the patients, the whole healthcare environment is like playing a role in your learning process. So it's important to like structure your learning as, just plan, like you need to plan as, when you go to the ward, what will you be doing that particular day? Because every day cannot be as a perfect history taking and physical examination and clerking the patient day, okay? Because sometimes there are no good cases, or the patients might not comply with you on that particular day. So it depends. You got to be really flexible with this thing, because you never know, you cannot predict. On the days you got to go to the operation theater, you think operation theater and viewing procedures like endoscopy and all that, so all those things are more structured and organized, because they are like mentioned in your schedule, as well as that particular time you know what you're doing. But then apart from that, when you're in the ward, make sure you know what you're doing and not wasting your time. If at all you're not able to clerk a patient, make sure that you learn some skills. Like there are always nurses around doing the IO charting or monitoring the vital signs or anything. Learn such small skills. You probably know how to take a blood pressure, temperature, and pulse rate and everything. But then medicine is all about practice. You need to keep doing them over and over and over again to be perfect at that particular skill. So learning small skills, and be curious about the devices around you, like a ventilator, or as small as there's something called this PCA, like patient control analgesia. So it's like a small machine next to the bed, and the patient has the control of the analgesic, mostly morphine. So he is able to like control it with the remote as how much analgesic is entering his body, and especially when he's feeling the most painful. So things like this nobody taught me. Like you need to be like curious when you look at the devices. Ask the nurses how to operate this device, or what's the purpose, or you can even like do some self-learning, like when you look at the device and you don't have anyone to explain yourself, always make good clinical notes, guys. So it's very important to make good clinical notes, not just when you're clerking the patients, but also about other stuff. Like when you look at something and you don't really know and you're not able to ask anybody about it, always make a note of that particular thing, go back and then research about it. Never let anything like undone or unfinished for that particular day. Finish the particular day stuff on that particular day. Even as small things as when you read the case notes as a new when you're newly into year 3 and newly into the wards, you sometimes don't know the certain abbreviations which doctors use while writing the patient's case notes. So even such small things, sometimes we feel lazy and we don't really like look into things, but it is very important to note down and learn on everyday basis as what you don't know, because there's so much around you that's very new to you, and you're suddenly put into this clinical environment, and like nobody's really guiding you properly. And so it's very important that you plan and structure your learning, and always always spend as much time as possible in the wards, because it is not like year 1 or year 2 where it's like more theory. Theory is there, it is important as well, but clinical knowledge is more important, because even if theory, you know everything and you're able to by heart everything, memorize everything, and everything is in your heart, but if you're not able to apply it in a clinical scenario, then it means nothing as a doctor. Like, unless you want to become a researcher or a professor or something with a teaching line, yes, but as a clinician, as a medical doctor, you need to be able to apply things. So applying your knowledge is most important thing. The most important thing, one more thing I would like to highlight, is DIY. So you would wonder why I'm telling DIY, but yes, do it yourself. Every single thing, do it yourself, because as small as a DRE, the digital rectal examination in the surgery wards, I'm sure you guys know what it is. So that one also, in textbook they tell this is what it feels like, and there is theoretical description as how a BPH feels like, how a prostate tumor feels like, how a cancerous mass should feel like, but then when you do it yourself, it's not like what they describe in the textbook. So this particular thing I like to describe as real life versus real life. So in medicine there are so many things in the textbooks which are mentioned as this is this, but when you go to the clinical life, you see the reality is something else, the clinical practice is something else, because like the WHO guideline will say one thing and all the guidelines say you one thing, but then you see the clinical practice is different, because it depends on that particular area what is more feasible for the patients, as even things like drugs, etc. Maybe you need to consider the economic conditions, the availability of resources, and all that. So it's important to learn clinically what is being practiced in the particular hospital as well as that particular region.